the number of people who suffer from diabetes in Africa remains unknown. But one thing is certain, the disease is gaining a foothold on the continent. Joining me in the studio to discuss this further is Dr. Opeolu Ojo, who's on a mission to create more awareness about the disease on the continent. Thank you for joining us, Doctor.
You're welcome.
Now let's just jump straight in. You recently went to Nigeria on a campaign to talk about creating awareness. Can you tell us a little bit more about that?
Yeah, thank you. My name is Opeolu Ojo, and I'm a lecturer in biochemistry at the University of East London. I was in Nigeria in July to execute a project funded by my university. We tagged the program, What You Eat, because really we know that what people eat can predispose them to developing the disease. And so what the project was all about is to create awareness, because from research we discovered that the level of awareness of the disease not just in Nigeria, you will be shocked that even in the UK, not so many people are aware about what they need to do to prevent the disease or how to manage it when it's already developed. So that's what we were screening people in rural areas. We went to 2 cities in Nigeria, and we're distributing literature materials that give more information about the disease. And so that's what it was an exciting time, really. Yeah.
Now, why is it so important to share this information with people from Afro and African communities in particular?
Yeah, it's really important because, as you said at the beginning, number one, the incidence of the disease is increasing globally, not just among Africans and Caribbean. It's increasing everywhere, even here in the UK. And the unfortunate thing is that people are not taking the measures that need to be taken to curb this increase. And so it's time for us to begin to talk more about this and to create awareness, increase our effort, in creating, getting people to know that this is becoming a problem. It's actually a problem, and that we need to tackle it. And so one of the major highlights of our trip to Nigeria was to give lectures. I was in secondary schools, I was in some primary schools, I went to also some gathering of old women, some retired civil servants, and I was talking to everybody, about why we need to tackle this problem. And again, it's people from West Africa particularly are predisposed genetically to diabetes, and so that's what actually sparked my interest in going to Nigeria. Red Indians, people from West Africa are more predisposed to the disease compared to people from other ethnic background, and that's one of the major reasons why we were in Nigeria.
That's quite interesting. Can you share with us a little bit why it is that people from West Africa have more of a predisposition?
Yeah, the research is still ongoing, but a factor has been found in the genome of people from West Africa that predispose them to the disease compared to other Africans. And also, of course, while I was in Nigeria, I was not just creating awareness, I was also doing some research. I collected a lot of data to see, is it the food that West African eat, or you see what triggers this genetic factor, what triggers it. So that's one of the things that I'm still working on, to know, is it habit, or is there something among West Africans that triggers this, the genetic thing. So that is still ongoing, and so it's still not yet finished. We're not yet there, but we're working on it.
Now, I'm glad that you mentioned data collection, because when we were doing some of our research, we found that there isn't a lot of statistical evidence about diabetes in Afro communities in Africa. Why is that, and why is it so difficult to get those figures?
Well, I think you will know that in Africa generally we have problems with collecting data, not just on health issues, in so many other areas also. And again, Nigeria is not different from the rest of Africa. But one of the things we are doing on this project is that we're creating databases. The project is still in its early stage, and what we want to do is to see if we can put platform and put a structure on ground to collate data and have a database where people can access freely and get information. I know that's going to come with some a lot of challenges, but that's one of the things we want to do, so that in future, if we want people, for policy, you want to make some changes, you want to, policy formulation and things like that, you need this, you need data. You need to know the status of the disease in this different in the population we're talking about now. And so that's why one of the things we're doing. The major problem is because of lack of infrastructure. People are not properly trained. And so when you go to some of the hospitals, you'll be shocked at how they keep records. It's really appalling.
Now, you mentioned policy, which circles round to government. In your experience, how is Nigeria's health ministry doing in promoting awareness about something that is such a big issue in the country?
The truth is that I don't think that the government is doing enough. Of course, the government of the day particularly now has a lot of challenges, and we know the issue with malaria is there. And perhaps because, diabetes is not like Ebola. It's not like HIV. And so maybe that's why people still, if you develop diabetes, you can still live for some time, even though it kills. Okay, and because of that, perhaps that's why you don't see the kind of response we saw during Ebola, during the Ebola outbreak. And that's one of the reasons why we're doing this awareness, that look, we don't have to wait until we have a problem, an epidemic in our hands. The things, people in Western world don't die because of diabetes any longer, because the awareness is there and the government is responding. The NHS in the UK, for example, have fantastic programs. So and that's the kind of thing we want to see in Nigeria. The good thing is that some of the legislators, like during my recent trip, I met with some political office holders, and some of them are showing interest already, in joining us in the campaign. And that's really the good news, that we brought from Nigeria.
So if there was something that you could say or do to get governments more involved in your project in particular, what would you suggest that their impact be?
In fact, one of the things that I'm actually working out to do is to find an opportunity to address the National Assembly. Because some of these politicians also either have relatives that suffer from diabetes, or they themselves might be predisposed to it, or they might even be suffering from it. In fact, one of the highlights of my trip, I was in one of the hotels in Nigeria, and I was on the lift. I've written this book that contains information, and so whatever I move around, I carry copies with me. I was giving it out free. And I met this gentleman in the lift, and I said, hey, I'm in Nigeria, and this is what I'm doing. Immediately, I gave him the book. He said, oh, I've been diabetic for the past 17 years. And so we had, about 30 minutes with talking about chat, and I was interested in knowing how he's been managing. And so I think one of the things we need to do, if we get some of these political office holders to get them aware enough, perhaps we could begin to see changes in the policy.
Now, of course, we hear the saying prevention is better than cure a lot. Now, someone who's watching our interview and thinking, I want to know more, I want to do better, what advice would you give them in terms of making the first step towards positive lifestyle changes? Yeah, the first step is to make sure you live active lifestyle. Now, the problem with diabetes, is in two ways. Of course, if it is type 1, you will know that the pancreas is being attacked by the body, and so that the pancreas is destroyed and the body cannot produce sufficient insulin that's needed. But for type 2 diabetes, it's in two ways. It could be that the body is not producing sufficient insulin, or that the insulin that is being produced is not utilized properly. A lot of factors could lead to that. But one of the things we discovered is that when people live sedentary lifestyle, they're not active, and technology is not even helping us these days. You see people on phone and playing games, and they're eating crisps and taking soda, things like that. So we feel the first step to take is make sure you exercise, you live an active lifestyle. Even if you have too much sugar in your body, in your system, but when you're active, you burn them. So the chance that the sugar will accumulate will be reduced. That's number one. The second thing, in fact, is why we tag this project, You Are What You Eat. Watch what you eat, what we eat. The timing of food, how much carbohydrates, There's something I've written in this book about carbon counting, how you can work out what you eat. Don't just eat carbohydrate-laden food. Eat a lot of fibers, fruits, and things like that, instead of just, and that was really handy while we're in Africa, because African staple food, most of the things we have are really, heavy laden in starch and sugar. Thank you so much. We have to cut it there. But it's been really insightful. Thank you for joining us.
Thank you.
Thank you.